For this next section, we're going to look at caffeine. We'll talk about the physiology of that, how it affects our energy levels, and how we feel. Talk a little bit about its link to physical activity and sports, and then also some of the cognitive benefits, and then also the recommendations and guidelines for caffeine intake. There is some evidence to suggest that coffee and caffeine may have had an effect on the outcome of the Civil War. A lot of what went on during the Civil War was linked to availability of certain supplies and goods, and the North had access to coffee, the South did not. And so the North was able to give that to their soldiers as they were going into battle, whereas soldiers of the Confederacy did not have access to that. And there's a lot of stories that talk about how the Northern soldiers, when they were given the coffee, how it boosted their spirits, boosted their morale, and it gave them that extra edge that they needed to go into some of those harder battles. So coffee may have had an effect on the outcome of the Civil War. Not saying that for sure, but there might be a link there. Most of the caffeine that we consume is going to be used by the body. There is going to be just a very tiny amount that's going to be released through the kidneys. So most of what we consume, we will use. About 1 to 2 hours after we consume caffeine, that's when it's going to reach its highest level in our blood. And then caffeine has a half-life of about 5 hours. So what that means is that if we have a 5-hour energy drink, which has about 200 milligrams of caffeine, say we have that at 5 a.m., well then at 10 a.m., we're going to have half that amount. We're going to have 100 milligrams of caffeine in our body. So if we keep going forward, at 3 p.m., we're going to have 50 milligrams. At 8 p.m., we're going to have 25 milligrams. And even when we're sleeping at night, we're going to have a little bit of caffeine in us. Around midnight, we're still going to have about 12 to 15 milligrams of caffeine in our blood. That's if we don't consume any extra. So caffeine is going to stay with us for a very long period of time. And what caffeine does, it doesn't actually provide us with any energy, but it's going to increase our heart rate and it's going to increase our blood flow and the blood pressure. We're also going to breathe a little bit more quickly, and this can help to reduce something like shortness of breath and even chest tightness in people with asthma. The main way that caffeine is going to make us feel more perky and more upbeat is due to its effect on a hormone that's known as adenosine. And adenosine in larger quantities is going to cause us to be tired, and it's what makes us go to sleep, it's what makes us be drowsy. The reason that caffeine is going to affect adenosine is because it binds for the same receptors in the brain. And if adenosine is not able to bind to its receptor, then it's not going to be able to have its function. And so when we drink caffeine, caffeine is going to bind to a lot of the adenosine receptor sites, so the adenosine cannot actually bind as well, and so we don't feel tired. Now, the problem with that is that the adenosine doesn't go away. It stays in our brain and it continues to build up, and then as that caffeine starts to wear off and detach, then the adenosine is going to flow in and it's going to make us very tired all of a sudden. However, it can trick our mind into thinking that it's not as tired, and so we're able to function a little bit more effectively and without thinking about and feeling that fatigue that's gradually building up. So caffeine is also going to lead to a greater release of feel-good hormones like dopamine and serotonin, also norepinephrine, which makes us more energetic, more excited, and it can also increase our levels of adrenaline. Caffeine helps to stimulate the central nervous system. It increases the brain's reaction time. This is going to benefit memory, our alertness, awareness, and mood. more concrete aspects of cognition, doesn't have quite the same effect um, on creativity, just on memory, alertness, awareness, and mood. There are also some benefits that are linked to physical activity. We have a decreased perceived exertion and a reduced feeling of fatigue due to higher levels of caffeine and lower levels of adenosine in our body. Um, Caffeine increases our alertness and awareness, so we're able to put more attention into the exercise that we're doing. We have greater power output. We release more endorphins, so we're more engaged and we enjoy the exercise a lot more. There's more norepinephrine in our system, and norepinephrine forces our heart and our muscle to contract more strongly. Um, and then after exercise, if we have more caffeine, we're more likely to store carbohydrates as glycogen. After exercise, our muscles and our liver, they're like a sponge. They're going to soak up more carbohydrates that we can use for physical activity later on in the day or a day or two from when we exercise. Um, Having caffeine in that mix, that makes us even more likely to store those carbohydrates. So our muscles and our liver are more like a sponge with caffeine in our system. With caffeine, we are going to generate more heat in our body, and that's pretty much just what calories are. It's just heat inside of us. And then caffeine also stimulates lipolysis, or the breakdown of body fat. So we're burning more calories when we have more caffeine. And as a general rule of thumb, people that are more focused and more attentive and more aware and alert, they are burning more calories. Even if they don't have caffeine in their system, um, people that are more alert burn more calories. Adding caffeine into the mix, it helps us to burn through more calories because we're more alert, more aware. There are some long-term chronic diseases that regular caffeine intake can help prevent against, and these include Alzheimer's disease and dementia, type 2 diabetes, Parkinson's disease, cirrhosis, kidney stones. And then from a behavioral health and a mental health standpoint, there's a decreased risk of depression and a significantly decreased risk of suicide by regular consumers of caffeine. So there's a lot of good with caffeine. The next few slides are going to look at the more negative side of caffeine intake, and then guidelines for how we can prevent against excess intake and these negative health effects. Excess caffeine intake overworks the central nervous system, and this induces sweating, dizziness, nervousness, anxiety, and depression, difficulty sleeping, muscle twitching, and rambling thoughts. We've talked about GERD before when we were going over digestion, and what goes on with that is you have stomach acid, which is very acidic, going back up into the esophagus, which can cause pain because it kind of burns that esophageal lining. So what caffeine does is it makes the stomach acid even more acidic, so that can cause a more significant negative effect with the burning if stomach acid does get back up into the esophagus. The good news is that we would have to consume quite a bit of caffeine to exceed this limit. The recommended intake for adults is about 400 to 500 milligrams per day. For us adolescents, it's a lot less, just 100 milligrams, but 400 milligrams per day for adults. And what this looks like is about 2 of the 5-hour energy drinks. Each of those contains 200 milligrams, unless you get the extra strength ones. Cup of coffee generally has about 70, 80 milligrams. Red Bull has around 100 milligrams. Sodas that have caffeine, those have about 35 to 40 milligrams. Lots of energy drinks like Monster, about 140, 150. And then a drink like Bang or Rain has 300 milligrams per each container. I really like taking the Bang or the Rain right before a workout, but if I do that, I have to make sure that I don't drink much else caffeine for the rest of the day. With very extreme intake, you can have some very significant consequences like delirium, vomiting, convulsions, neuromuscular tremors. Back when I worked as a caddy, years and years and years ago, there was a guy who was sitting around all day, did not get out for work, and was just really, really bored. And so what he did is he started a fund where he collected money from all the other caddies that were there, and we had about 100 caddies usually sitting around, so I was able to get a good bit of money. Took that over to the 7-Eleven, and with that money, bought as many energy drinks as he could, and then brought those back to drink them. And I think that got him around 10 energy drinks. So he drank all of those, and shortly afterwards, he was sitting next to a fan, looked horrible, was sweating, was throwing up blood, just looked really, really, really bad. So a very high intake of caffeine does have significant negative health consequences. And if you consume 10 to 14 grams, which is a lot, it's a lot, that's the point at which caffeine can kill you.